Hi, Assalamualaikum and a very good morning to everyone. Thank you for coming to today's talk. First of all, let me introduce myself. My name is Rabiatul Nabila binti Zainal Abidin. As you all informed, today's talk is about how to prevent low birth weight during pregnancy. I hope you all enjoy during this talk. Okay, first of all, we will move to the definition of low birth weight. Low birth weight is defined as the babies that are weighed 2,500 grams or 5.5 pounds by WHO. This is because the babies spend the less time in their mother's womb, makes them less weight than the normal babies. This is because most of the babies' weight gain during the last pregnancy. These low birth weight babies are very susceptible to disease, then they will have problems and also disadvantage growing up and require close attention and management. Okay, next we will move to the classification of low birth weight. There are three classes that classify as low birth weight babies. The first one is low birth weight, which the weight is below than 2.5 kilograms. The second classes is very low birth weight, which is first weight recorded is 1.5 kilogram. And the last one is the extremely low birth weight. It is when the baby's first weight recorded is below than 1 kilogram. Weight, length, and head circumference are the measurements to classify the newborn babies. To classify them, newborn babies will be measured in their first hour of life or not exceed than 48 hours of life. This is cited from Medscape in 2019. If the measurements taken are below than 10 percentile, they are known or classified under small gestational age or SGA. Okay, for the next slide, risk factors for mother are poor prenatal nutrition and inadequate weight gain, have gestational diabetes mellitus or GDM, pregnancy-induced high blood pressure, also have chronic health conditions like heart problem and high blood pressure, use of alcohol, cigarette or drug during pregnancy, and also age of the mother are under 17 or over 35 years old. Next slide, complications that can occur like trouble in gaining weight, breathing problem due to immature lung, nervous system problem, including bleeding in brain, and also jaundice because it too much bilirubin in the blood of the baby. For the long-term complications include motor disability in childhood or also known as cerebral palsy, blindness and deafness, and lastly, developmental delay. Next, food that need to be consumed during the pregnancy are fruit and vegetables, fish and seafood, milk and dairy product, meats and its substitute, and also carbohydrate. This must be consumed by the mother to give them energy and also important for their fetal growth. However, the food that need to be avoided like food high in caffeine, alcohol, and also undercooked raw meat or fish. This must be avoided because it can lead to infection and also may lead to preterm birth. Okay, in this slide, there are some tips that mother can practice or follow to prevent from having low birth weight baby, like start prenatal care early, keep pre-existing medical illness under control, make significant changes for the lifestyle, and maintain healthy weight gain and good nutrition during their pregnancy. This tip can be followed by the mother for them to have a normal and healthy baby. Okay, for this slide, we can see the prevalence of low birth weight in the Malaysia. In the rural area, they are 10%, while in the urban area, they are 9.5% of the prevalence of low birth weight in Malaysia. Lastly, for the conclusion, pregnant mothers should practice healthy lifestyle and listen to the doctor advice during their pregnancy because it is important for their health and also important for their fetal growth. So I think that's all from me. Thank you for joining this talk today. I hope all the knowledge given will be useful for your future. So with that, thank you. I think that's all from me today. I hope that the knowledge given will be useful for your future. Thank you.